Very simply, cough medicines don't work. They don't change the child's cough. Most coughs and colds are caused by viruses. Antibiotics don't work for that. Over 1,000 research papers published on this. And it was clearly established cold weather does not cause colds.
And what about RSV or croup? How does that fit into it all?
Flu is not just a normal cold. Flu is more severe and it's got more severe complications that go with it. If you try and aggressively keep your temperature down, it takes you a bit longer to get better.
Hello and welcome to Kids Health Explained, a brand new podcast by the Sydney Children's Hospitals Network. I'm your host, Sophie Delezio. Some of you might know me following my healthcare journey, but nowadays I'm a mum to a beautiful little boy named Frankie. And that means I spend lots of hours learning, worrying and Googling just about every aspect of his health, pretty much like every other parent and caregiver. This podcast is designed to help all of us feel a little bit more confident when it comes to our children's health, understanding what's normal, what's not, and when to seek help. Each episode, I'll be joined by expert clinicians to talk through healthcare topics parents ask the most, from fevers and first aid to emotional well-being and navigating the healthcare system. During this first season, we'll be dropping new episodes every 2 weeks on Spotify, Apple, and all your other favourite podcast platforms. And there'll also be video versions available on YouTube and Spotify too. To stay up to date, please subscribe and follow Kids Health Explained. Enjoy! It's winter. It feels like everyone has a cold, just like I do right now. Your child's nose seemingly never stops running, and just when they recover from one cold, another one rolls right in. For many parents, it can feel endless, not to mention worried and a bit confusing. Is this just a simple cold, or is it something more serious? Should I take them to the doctor, the emergency department, or just let them rest and they'll recover? Are antibiotics an answer? What about cough and cold medicines? Their questions are as endless as the runny noses are. To answer your questions and mine, joining us today is Dr. Matt O'Mara. Matt is a paediatrician and emergency doctor with over 30 years experience. And with his expertise, he's going to help us understand what's normal, what's not, and separate fact from fiction and bust some myths. Welcome, Matt.
Thanks, Seth.
Let's start with the basics. People say that their kids are sick all the time during winter. Is there a point where it becomes too much, or you're concerned that the frequency at which they're getting a cold?
We do have a lot of parents bringing their kids to emergency all through the year with coughs and colds and fevers. Sometimes it seems like kids are getting endless infections, one after another after another. It's pretty normal for kids to have an infection every month or two. Sometimes they cluster together. So you have one and then another one and then another one, and it seems endless. And sometimes you have a good run where they haven't had anything for a while, and it's just
The
lovely.
dream. Don't we all want that? Oh my gosh. And so it's just a part of growing up, I guess. These common colds, at least, it's to be expected and not.
It's to be expected. Look, there's over 200 viruses that can cause colds.
Wow.
We know the names of some of the most common ones and can test for them, but really there are so many different infections kids can get.
You know, you think of just a cold being one thing and it's like, why he's constantly getting that one thing, but opening it up to that many different options that can cause it, it's incredible. And what about RSV or croup? How does that fit into it all?
Okay. RSV is the name of a particular virus, respiratory syncytial virus. And that's a virus that we know commonly causes colds in adults, in children, but in young babies causes a particular pattern of illness called bronchiolitis, which makes babies have a cold, goes to their chest, they cough, they wheeze, they find it hard to breathe and hard to feed. And that is the commonest reason why young babies get admitted to hospital. Wow. There's now a vaccine during pregnancy or for young babies for this to help reduce the rate of kids being unwell with it. Croup describes a clinical pattern of illness, another viral infection, often caused by a virus called parainfluenza, but it can also be caused by other viruses too. Starts as a cold, goes around to their voice box, gives them a hoarse voice, gives them a barking sort of cough, and may make them breathe noisily and find it hard to breathe. And that's what croup is. We can't treat the viruses when they've got them. With RSV, there's a vaccine now. For croup, we can't treat the viruses that cause it, but we can treat the problems that virus causes, particularly with steroids for kids that are having problems breathing.
Say you have 2 children or more. If one of your child has RSV or croup or any of the hundreds of viruses out there, what do you recommend? Do you recommend trying to keep them away from each other as much as possible, or almost like the whole chickenpox complex where it's like get it over and done with in one go?
I think it's really hard to keep kids separate in the same household. And they're often infectious for a day or two before they start getting sick. So there's a reasonable chance that virus will have spread anyway. What can you do? The simple things. Wash their hands, because from the coughing and the sneezing and touching things, if they then put their hands on their face and their mouth, they're more likely to acquire the virus that's circulating around their environment. And for kids that are old enough to, if they can cover their nose, or sneeze into a handkerchief or a tissue, and cover their mouth when they're coughing, just to help stop the viruses spreading so far. But I think aiming for the impossible and isolation in different parts of the house, that's a pretty tough thing to do. And I'm not sure that's feasible for most families to do.
Yeah.
What's the worst thing that'll happen? They might catch the virus that's just circulating around that family.
What's the best way for parents to help their recover at home if it's just one child or all their children? Like, my fear is, do I take him outside? Do I give him fresh air? Or do I keep him up, like keep him inside in a little insulated bubble?
What I think children need is often rest, comfort, fluids, medicine to make them feel a little bit better, particularly if they're hot. And that's about all you can do. This may be the sickest they've ever felt. And what do they need? They'd rate themselves like little koala bears, on the parent. And they just want reassurance and comfort. And that's probably the biggest dose that they need, more than any medicine. Encouraging to have fluids, and not just any fluid. Water's okay, but they also need fuel and they also need electrolytes. And while you can get that in manufactured things, which comes in ice blocks or different liquids or powders and that, you can also get that from having a range of different things to eat and drink. And even though kids who are sick may not eat very much, would like them to have a bit of range of things. So they're getting some calories, some energy, as well as some fluid. And they're often getting the salts in different things they're eating and drinking. So there's ways of doing it. Water on its own doesn't give them energy and doesn't give them the electrolytes they need. And we can see some kids run into problems where they sort of run out of fuel.
I always thought, electrolytes, that's a grown-up thing, but...
Yeah, well, hydration, that's part of it. It's hydration, plus fuel, plus some salt.
Yeah.
What else helps? Some young babies get really bothered when their nose is blocked, especially babies who are feeding, sucking on a bottle or breastfeeding, because there's nowhere else for the air to go through. And they'll also prefer to breathe through their nose and their mouth, especially when they're asleep, and they can get bothered and not sleep as well. So doing simple things to help clear their nose, wiping it. The saline drops can make a difference. Sometimes the simple suction things can help, but only if it's blocking their nose. There's a lot more mucus where that came from. It'll reaccumulate again, and medicines won't change that happening. All you can do is clear it, especially if your child's having problems breathing, especially if they're having problems feeding, and if it's bothering with their sleep as a young baby.
And I know my son currently has that, where he's so blocked up that when he's sleeping, he's a stomach sleeper, that it just builds up and he gets these coughing fits. But during the day when his nose is clear, it's fine. Is there anything a parent can do to help with that, chesty cough?
Okay. So cough medicines, very simply, cough medicines don't work. They don't change the child's cough, no matter what brand, no matter what colour, no matter what the marketing is around them. They just don't work. It's been shown in many, many, many studies. So I wouldn't bother. Coughs are often worse at night. And there's not much you can do around that. Whether it's because the mucus is trickling down the back of their throat and irritating their throat can make them cough. Or whether that same virus that's causing their nose to be a problem has also got some irritation of their cough receptors in the linings of their airways, might be doing it. The mucus actually doesn't travel into their lungs. Mm-hmm. Your body is really good at protecting stuff going into your lungs. It's just usually going to the back of their throat, or the illness is irritating them, make them cough a little bit. It's there to protect your lungs. It's to stop stuff getting in there. And so your body's doing the right thing in coughing, in trying to expel mucus that comes from inside the chest itself, or irritation that's there. So it's a good, safe thing to have a cough reflex. It's just annoying when it happens and interrupts their sleep.
So it's, wow, coughs are good.
Coughs are good. Coughs are good, but coughs can be annoying.
Yeah.
And especially those dry coughs, it's just part of the illness. What can you do for a cough in those situations? Humidifiers don't work. Cough medicines don't work. It's comfort.
Is there a point that we should be worried?
All right. So after kids have a cold, it's pretty common for them to cough for a week or 2 or 3 or sometimes even 4 weeks later. That's a normal thing. Why does that happen? Sometimes those cough receptors get turned on, okay, and get a bit irritated, and we need to wait for that irritation to settle down. Coughs that go on for more than a month, and I mean, this is not just one cold, well, for a few days, another cold, a cough. It's persistent every single day that goes on for a month. Check in with your doctor around it. Sometimes there are other causes for a cough that are there. Could be something, the child's inhaled something. Could be another type of infection. Could be another type of problem that's going on that needs a medical professional to have a look and see what's going on with that child. But a lingering cough for a few weeks, unfortunately, that's normal.
Whenever my son is sick, I immediately think of Panadol and Nurofen as the first point of call. Do you recommend it?
They work. They are similarly effective for pain or for fever. And really the aim of those medicines is not to bring the child's fever down to a safe level. There's not an unsafe fever, from an illness. It's to try and make your child feel more comfortable. If they're hot and not bothered, there's no need to give it. If they're hot and miserable and cranky, I'd give them something for it. Which one? Some kids like the taste of one better than another. And so if it's easier to give one than another, use that one. Some parents find that one medicine seems to work better on their child than another. Use that one. You can use both of them together or in staggered intervals. Just gets a bit more complicated to keep track on what you're using. You can do it for fevers, but again, you need to think about, am I trying to bring the temperature down or am I trying to make the child more comfortable? And I think the aim really should be the child's comfort. Temperatures go up and down by themselves. Medicines might make 0.5 or 1 degree difference to that, but it's all it will do. It'll make a little bit of difference to the temperature. It'll make a little bit of difference to the child's behaviour, but that's all they'll do. There's a purpose behind fevers. Fever is what your body is doing to help fight an infection. We know that if you try and aggressively keep your temperature down, it takes a bit longer to get better. So it's okay to have a fever. It's what your body is designed to do. Your immune system works a bit better when it's hot. So there's benefit in that. What we're trying to do is modify that for the child's comfort.
Is there a fever that is too high? When do you need to seek medical attention?
There's no dangerous temperature from an illness. We are more concerned with temperatures in young babies, not because the fever is dangerous, because it may be a clue to a serious illness underneath. So babies under 3 months of age, we go, temperatures over 38, get checked. Kids under a year, often advice is temperatures over 39, get checked. Why in those kids? Because it's harder to tell when they're sick. They're more likely to get some infections. They're not fully immunised. They haven't been exposed to as many things. And so it's a little bit trickier to tell what's going on. So the fever isn't harmful. It's just, what does this fever mean? What's the illness that's causing it? And do we need to look a little bit more carefully?
And with those little kids, like especially under 3 months, and they have those fevers, GP or hospital, what's your recommendation?
Babies under 3 months, they'll need looking at by someone who can see them, certainly the same day, preferably within several hours, just to check on what's going on. So if your GP is available, absolutely great. If it's your local hospital or urgent care centre, either of those would be good.
Mm-hmm.
As they get older and it's easier to tell what's going on, you've got the full range of health services that are available, whether it's your GP, urgent cares, emergency departments, or again, those advice lines about what should I do in this situation.
Mm. And with those fevers, there are a million thermometers on the market nowadays. And I remember before I had my son buying, I think I bought 3 different types of thermometers. Is there one that is more accurate, especially for young kids?
What works best and what's being shown to work best is an underarm thermometer.
Mm-hmm.
It's an approximation of the temperature of really what your core temperature is like, but that's the best way. The other useful thing is a parent's hand.
Mm.
There's actually been studies that show that a mother's hand is as good as picking up a temperature over 38.5 degrees as a thermometer is. And so there's that sort of instinct.
Mm.
Do they feel hot? Are they warm? Are they hot or not? Probably takes a while to develop that. But then you can get a sense of, what do I do? Are they hot? Should I be concerned? Really hot? And backing it up with a thermometer to check if you're not sure.
Is there any benefit of seeing a GP and getting a swab when your kid is a bit unwell?
So for me, when I do a test, I want to know what's the purpose of doing it? What am I going to do differently if I know that? And often doing a swab on a child who's got what seems to be a cold will give the name of a virus to that cold, but it's not going to make us do anything. It's not going to make us watch the child more carefully, be more aware of things, or give different treatment. So I think it's got a really limited role for kids who seem to have a typical cold. I'm also a bit concerned that sometimes it can stop you looking for other things. There might be a virus that started this, but has your child got an ear infection or a chest infection or another thing on top of the virus that was there? So it doesn't tell you the whole picture of what's going on. It gives you a little bit of information. What are you going to do with it? And sometimes it may even stop you looking for what's really going on underneath this. So I would save your child the discomfort of getting their nose swabbed, because it's probably not going to help most of the time for kids that are well enough to be managed outside hospitals.
And what part does antibiotics have to play in all of this?
Antibiotics are good for bacterial infections. Most coughs and colds are caused by viruses. Antibiotics don't work for that. So bacterial infections can happen on their own, and they tend to affect one thing. They tend to cause a throat infection or an ear infection or a chest infection. But if your child's got a runny nose and a sore throat and a cough and a fever with all that, and it's happened at the same time, that's almost certainly going to be a viral infection that's doing it. And your child will get better without antibiotic treatment. I know sometimes doctors want to meet parents' expectations or make assumptions about what parents want. What I think is much more useful as a parent to go and is trying to say up front what your expectations are. I think they might have a cold, but I just want to have a check. And I'm really, prefer to hold off antibiotics, setting the expectations up front. Or it might be, I don't think this is just a cold. I'm really concerned they've got something else going on, and I think they may need antibiotics, and I'd like your opinion on that. Or can I get the script but not start it unless they get worse? They're perfectly sensible management plans for the right situation. And so your attitudes as a parent matters as well as the assessment of the doctors.
And so antibiotics doesn't always have to be the only fix.
Antibiotics are often not the fix for coughs and colds. Most of them are viruses. Most of them get better. You don't need a swab to prove that.
And when it comes to things like croup or wheezing, when should a parent call an ambulance?
I think parents should call an ambulance when they're really concerned that their child's got a severe problem. So that means they're finding it very difficult to breathe. Okay, they're putting all their effort into breathing. They're breathing quickly. There's a lot of sucking in going on, a lot of tummy movement happening. The worse their breathing is, mean that child needs help more urgently. And in kids who are old enough to talk and do that, how many words they can get out? Can they talk in sentences? Can they talk in phrases? Can they just talk in words? Can they not talk at all? That's really serious when that happens. Kids can also tell you what they feel about their breathing. You can go, my breathing doesn't feel good. Trust them. They're right. They'll know what it feels like, even if there isn't so much to see. So I think looking, talking, and sometimes the child's own response, how they feel.
You know, you're always unsure about sending your kid to school or daycare, whatever it is, when they've got a little cold or just a runny nose, or when is the right time to send them back? Is there a sweet spot where you feel like you can send them back, or dependent?
I think when they're well enough to go back to school or daycare, they should probably go back to school or daycare. When they don't have fevers, when they can cope with a day of activity and busyness and aren't seeking that comfort from a parent frequently, when they're drinking enough and eating enough and just up to the rigors of a busy day is probably the time. And so if they are sneezing less and coughing less, or if it's a gastro thing, if diarrhea settled down, it's okay.
And I'm sure you see a lot of different levels of intensity of sicknesses in emergency department. Do you see there's a lot of first-time parents, probably more significantly than most, coming in when their child could just go to a GP, or you're just happy that they come in? What's your kind of view on?
Okay. I think there's many doors into the healthcare system. There's times when hospital is absolutely the right place to be, but there's often other options as well. Learning that often takes experience. So as a first-time parent, you go, what's normal, what's not? How abnormal is this? What do I do? Your general practitioner, your GP, is often really good at working out, is your child sick or not? There's hospitals which are open 24 hours a day. They're all around the state. And they are good at looking after kids with a whole range of different problems. And they can also help assess what's going on, whether it's serious or not. And then the most unwell ones, you might need to call an ambulance for. There are some really good resources to help make those decisions, including Health Direct. And Health Direct is a government-funded organisation where you ring them up, you'll get a nurse on the end of the phone who'll go through a series of questions and help you work out how unwell your child is and give you advice. Some of these are also complemented by telehealth services, so I can connect to a children's nurse who can help assess you, and even using video. There's a lovely resource that is around about recognising a sick child. There's a checklist on the Sydney Kids Network website. There's similar information on Health Direct and also on the Raising Children website. They really go into a very simple way that I remember as ABC, fluids in and out. A is for alertness, activity. What's the child doing? How are they behaving? B is what their breathing is like. C is what their colour's like. Are they pale? Are they mottled? Are they blue? Fluids in and out. Are they drinking at least half normal? Are they doing a wee or a wet nappy about 4 times a day? If you're doing all those things, they're active, their breathing seems comfortable, their colour looks good, they're drinking enough, they're weeing enough, they're probably okay. It's not likely to be an urgent thing. The more abnormal they become, or the combination of things, the more of those things that are abnormal, the more likely they are to have something serious. And so those tools can help you work out, this is where I am, this is where my child is. This is the sort of thing, I need to go now, I need to go soon, or I can wait a while.
So ABC, fluids in and out.
Yeah.
I know I've been in situations with Frankie and it's been, 3 a.m. You get a bit paranoid and you want to do anything to help your child get better. And I think it's nice having those clear messages to, stick to, and it helps as a guide.
As well as all that, there's instinct. And I would say trust your instinct. If you're really concerned, get help now. If you're not sure, there's these resources or Health Direct that's available just on the end of the telephone.
Yeah. Oh, it's amazing. I've used Health Direct a few times and it's just an incredible service, and I'm so grateful for the people on the other end. They must hear a lot of worried parents' voices every second of every day, and it's incredible that we have that.
It's interesting. There's actually a satisfaction in being able to help people work out what's going wrong and in helping them feel comfortable, with managing something in front of them. So whether you work in a hospital or whether you work on Health Direct, there's actually a joy in doing that.
Let's talk about prevention. What actually helps kids building up their immunity without getting sick.
The best way of building up immunity without getting sick is vaccination. There's a vaccine against influenza, and that's been around for a long, long time. And the vaccines keep getting refined. And you need a vaccine every year against flu because flu keeps changing. This year's vaccine is different to last year's vaccine because people are seeing what's going around and predicting what's going to be there, and they're pretty good at doing it. Flu is not just a normal cold. Flu is more severe and it's got more severe complications that go with it. But often people don't know the pattern of the disease that influenza can cause. It really does make you sick and occasionally makes you extremely seriously unwell. And kids do need to come into hospital every year. Thousands of kids need to be admitted because of their breathing or because they're vomiting or not drinking enough. And so the flu vaccine is one of the really useful things to do. It's free for kids under 5. But only about 25% of kids in Australia get the flu vaccine under 5 years of age, even though it's free. Move to the school ages, where there's a cost to it, vaccination rates are half that. So most useful vaccinations. What else can you do? Try and stop spreading it. The simple hand hygiene thing. Get the kids to wash their hands before they eat, before they drink things, before they touch their face. Hygiene with sneezing and coughing, if you can try and manage that to help stop the spread in the house. They're all the simple things you can do to prevent. But because kids are out and playing at school and in childcare, in social groups, they will pick up a whole range of different things. Most of the viruses aren't preventable, but the ones that are preventable, we should be using the opportunities that are there.
Absolutely. There are many myths about colds and flus and coughs. Can we do a little bit of myth busting while we're here?
Let's do that.
Great. The flu shot gives you the cold.
No, flu vaccine cannot give you influenza or any other cold. It might feel like a mild version of the flu. It is not the flu. It is milder. It is shorter. It's just your body's immune response to that vaccine. It shows that it's working.
Okay, good to know. Cold weather makes you sick?
No. That interestingly was studied. There was a British common cold unit that was set up just after the Second World War and ran for 40 years. And they did lots of experiments on colds. They had people standing out in cold weather. They did things with people playing cards to see about how things transmitted. Over 1,000 research papers published on this. And it was clearly established cold weather does not cause colds. Viruses cause colds. And the weather doesn't make any difference to whether you get a cold or not. The season doesn't make you more susceptible to get a cold. It just depends what virus is circulating at that time of year.
Fascinating. Before we wrap up this episode, I would love to ask you something a bit more personal about your achievements within your career. Is there a moment in your career that has shaped you and changed the way you perceive medicine and treat your patients?
I think when I sort of found my niche and attraction to pediatrics, it was particularly about how doctors and nurses could engage with a child. Start up a conversation with them about things, explain what's going on, understand what a parent's concerns were, explain to them what's going on in simple, plain English. And they're the things that still make me really interested today. And I keep learning from children and parents and nurses and doctors and allied health people about engaging kids and explaining to them and working out, is this a child we can go in and, have fun and they're very happy with the examination straight away? Or is it somewhere we've got to go really slowly and gently in their own way because that's going to work best for them, that's going to feel safe for them, that's going to help build the trust. It's a joy to work in a place like this where you've got extraordinarily skilled people, extraordinarily knowledgeable people, but I think especially kind people who are really good at understanding children and their families and engaging with them and communicating with them.
It's almost like you have 3 patients where you got the child and then you got the parents as well whenever you're treating.
Absolutely.
Hands full.
Yeah, it keeps it interesting.
Yeah, I'm sure. Thank you so much. I really appreciate you coming in today and your insightful knowledge on sicknesses, colds, flus, and fevers.
Thanks very much, Seth.
Thanks for listening to Kids Health Explained, brought to you by the Sydney Children's Hospitals Network and hosted by me, Sophie Delezio. If you found this episode as helpful as I did, share it with a family member, grandparent, or a friend who might need it too. And don't forget to hit subscribe so you're notified whenever a new episode drops. Bye for now.